not sure if it's the best, but we'll see. Many of you have been reading both in our newsletter and I'm sure online about the topic of infection control for cystic fibrosis. It's been a topic that's been around for more than 10 years, and there is shortly to be published a new set of guidelines from the Cystic Fibrosis Foundation. It's been a little bit delayed because there are some things that are a little controversial that people don't all agree with. So what I'm going to do is give you a little bit of a history. So I'm going to talk about how germs are spread, talk about the germs we worry about in cystic fibrosis, some little bit of history, and then a glimpse into the infection control guidelines, again with keeping in mind that they're not yet finalized, they still may change a little bit. Before I do all of this, I thought it might be fun to hear about germs from the germs perspective, so enjoy this video.
Hey, guards! Get back here! This bed is hard and the blankets make my membrane itchy. This is no way to treat the great staff sergeant! Corporal, how long have we been rotting away in this cell?
10 minutes, sir.
Outrageous! This never would have happened if it weren't for those PDI agents. I remember it like it was yesterday.
It was yesterday, sir.
Quiet! Our plan was flawless. All the troops were in place. The plans laid out for the great epidemic. Troops, today we launch our attack. Prepare to invade. E. coli's, you stake out the toilet handle.
Yes, sir.
Staffies, take your positions on the water faucet.
Yes, sir.
Shigevas, round around the door handles.
Yes, sir.
Who are they, sir?
Oh, that's just a piece of my sandwich.
That's very unsanitary, sir.
Quiet! Men, from these positions, we will launch our attack! You must stay invisible. Do not let them see you. Jump on when they touch your location and spread as fast as you can. We'll hitch a ride from this location and infect the city, the world, the universe! Remember, troops, fight dirty!
Get it?
We're germs.
We get it, sir.
You're no fun. Get ready, troops! Yes! He touched the handle and our troops climbed on board! To the faucet! Excellent! Our germs will be everywhere! Wait! He's using the soap! It's too powerful! Corporal, if he washes his hands with that stuff for 20 seconds, we'll lose the whole platoon! Oh, the humanity! Troops, fall back before he uses the paper towel to block us! No! We'll attack at the door handle! He's using the same paper towel to protect himself at the door! Sweet slippery sludge, Corporal! He's a trained PDI agent!
Stands for protect, don't infect. So you've seen one good way of preventing germs from spreading. We'll come back to these guys in a few minutes. So there are a whole variety of names of bacteria that we in the CF office talk about all the time, and I just want you to have heard them so that in case we talk about it with you, you'll understand. So that sergeant there was Sergeant Staffy, meaning Staphylococcus aureus, a skin bacteria that we all have. And most of the staff is pretty sensitive to most of the drugs that we have until it becomes MRSA or methicillin-resistant staph, and then we have to be a little bit more careful because it takes some specialized treatment. Haemophilus influenza is another bacteria. It's not related to influenza virus, and a lot of children have that in their upper airways. The one that we talk about all the time in CF clinics is Pseudomonas aeruginosa. Pseudomonas is the family and aeruginosa is the species, And Pseudomonas can be found everywhere in our environment. Any place that's wet in your house could potentially have Pseudomonas. So think about it. Where is it wet in your house? It's in the bathroom, in the sinks, in the toilets, in the drains, the kitchen sink, potentially in your refrigerator because vegetables get a little rotted and they leave moisture behind. Outside, the kids play in the soil, which has got moisture. There's lots of Pseudomonas around. Individuals who don't have cystic fibrosis are generally not bothered by Pseudomonas. Maybe if you have an extensive burn or skin wound, or if you have cancer and you're on chemotherapy, Pseudomonas might be a problem, but in general, we live with it and it doesn't bother us. Burkholderia cepacia is a species that used to be in the Pseudomonas family, which is one that can make people with CF pretty sick. And then we have some other names. Stenotrophomonas and Acinetobacter are both bacteria that can be fairly drug resistant. So sometimes it's not that it necessarily makes one sick, it's that it's very difficult to find drugs to suppress these. Atypical mycobacteria, they are members of the family that tuberculosis belongs in, but not tuberculosis. Only a small percentage of people have these. And then occasionally we come across people with fungus like Aspergillus in their lungs. So these are the types of things that our laboratory is very excellent in identifying. This just shows over the period of a lifespan from under 2 years to adulthood that the staph bacteria is the most common in childhood and it tends to go down in adulthood, whereas the Pseudomonas, although it can affect as many as 25% of youngsters, tends to get higher and higher as you get older. What's very interesting is this is about 75%, 25% of people that don't have it. Something's different about them, we don't know what it is. The methicillin-resistant staph, which I spoke about, never used to be even in this report. This is a report from the CF registry. But as time has gone on, we're seeing more and more of it to the extent now, if I can find the right line to point to, it's this red line, that upwards of 30 to 35% of teenagers and young adults may have methicillin-resistant staph. The good news, if there is good news, is this yellow line, and that is the cepacia rate has always remained low, and it is relatively low across the lifespan, as it is across time. This slide goes back to 1988, and it ends at 2012, and you can see that we're having more staph infections, mostly because the methicillin-resistant staph is increasing, this red line. And the rate of Pseudomonas, interestingly, is gradually going down. Again, we don't know exactly what factors are responsible for that. I didn't mention viruses. When we talk about bacteria in cystic fibrosis, no one is immune from viruses. We catch common colds. Kids can catch a common cold 8 to 10 times a year. Adults perhaps not that often. But it's the common cold virus that often stirs up the infections, and then we have to deal with the bacteria that live in the lungs. There's a difference between the word colonization and the word infection. Colonization means the bacteria live there sort of in harmony with you, and infection is they're making you sick. And sometimes it's hard to distinguish which is which. So a little bit of history. Back in the late 1980s, there were CF summer camps where large groups of people with cystic fibrosis would attend for a week or more. Did you ever go to one?
Huh?
Did you ever go to a CF summer camp?
No.
Oh, okay. Well, anyway, investigators started to look at people when they came home from camp, and at least in one report, they found that 9%, it's almost a tenth, of patients that went to camp not having cepacia in their lungs came back and cultured cepacia in their first visit. And people started to think about it and started to realize that this germ is spreading from person to person to person. So being that it was shown that it was transferable from patients to patients in camp and in a hospital setting, and also that methicillin-resistant staph can jump from patient to patient to patient, some of the foundation guidelines began at this point saying that we really shouldn't be doing this anymore. We shouldn't be having large groups of people with CF congregating with each other. In fact, I can remember in the 1980s, we'd have patients share rooms in the hospital. We'd put 2 or 3 people with CF in the hospital, why not have them share the room? Don't do that anymore. Here's some ways that germs can be spread. Contact transmission is where you have direct or indirect contact with secretions. If I cough on the table, and then I touch the table and touch my nose or eyes or mouth, I potentially could pick up germs from the table and get it into myself. So the sources for those things are hands of healthcare staff, toys that kids might share, contaminated respiratory equipment, etc. Then there's droplet transmission. Droplets are particles that either can linger in the air or again fall on surfaces. And infectious droplets nowadays can be shown to travel as much as 3 to 6 feet. In the hospital, when there's a double room, they usually try to have 6 feet between the beds. And it can be transmitted from person to person, from their nose, eyes, or mouth of a susceptible person. Fortunately, we don't have to deal with too much in the way of airborne transmission, such as in chickenpox, measles, which are viruses, and tuberculosis, so that we don't have to be constantly putting people in isolation and wearing masks. But certain types of infections are airborne, where you can just catch it by breathing the same air in the room. So most of the bacteria that we deal with are either from surfaces or person to person. Hand hygiene, that is washing your hands or using hand sanitizer, is probably the most important thing that you can do, as you saw in the little cartoon. So when is it important? Well, after touching items that are shared, after coughing and sneezing, if you're coughing into your hands, of course using the bathroom, before eating and drinking. I know when my kids were growing up, it was stressed to them very much that they had to do that before eating and drinking, and really any time their hands are contaminated. There can be serious consequences for not washing their hands. Maybe not quite as serious as what you see here. Now, we also talk about respiratory hygiene. So instead of just coughing in your hand nowadays, they recommend that you cough in the tissue that contain the germs, and don't put the tissue back in your pocket. I think I have a bad habit of doing that. You know, you use the tissue once and you want to save it for later on and you shove it back in your pocket. Well, you're just spreading those germs. So that's not a good thing. And again, hand hygiene right after coughing is recommended. So let's take a look at a second good way of preventing the spread of germs. Hopefully this will work.
Tough loss, Corporal, but we learned our lesson. We germs would have to get smarter to get people sick.
Now keep it down. We're trying to sleep.
And I'm trying to tell an evil story. Now, where was I?
About to have another flashback, sir.
Right! We prepared an all-out aerial invasion. There we were, a force of 10,000 gooey, sticky, nasty germs, ready to infect. Today, we will move out farther and faster than ever. Any moment now, all 10,000 of us will be launched into the world at 100 miles per hour, armed with all our germy weapons to attack the humans! Get ready, troops! Prepare for launch! Steady! Steady! Release the germs! What happened? Everything is all white. Am I dead?
We're in a tissue, sir.
I knew that. Well, we were stopped here. Let's hope the other platoon reaches their mission. Here he goes. No! Not into your sleeve! Foiled by the long arm of the law. Hey! Stay away from that hand sanitizer! You'll wipe out whole armies of germs! No! Where are all these PDI agents coming from?
So that's good coughing and sneezing etiquette. Coughing into a tissue or in your sleeve, and of course using the hand sanitizer afterwards. To introduce infection control guidelines, I have to point out that this is not the first edition. There are guidelines that have been existing for 10 or 12 years or so. And what the Cystic Fibrosis Foundation has done is they've compiled a committee of experts that reviewed literature and evidence that is published. So this is a very scientifically based document, then with expert opinion. They looked at inpatient settings, outpatient settings, and non-healthcare settings, patients just in their day-to-day lives. They also took into account the psychosocial implications. What impact is this going to have on patients as they go through their lives? And as I said, the document is still in draft form. We haven't seen the final copy, and perhaps by the end of the year it'll be published. Each center, of course, then has to decide, once we have guidelines, how does it make sense for us to apply what works best in their center. And Non-healthcare settings are school and home and in your car and places you might go from day to day. And healthcare settings, of course, are when you come to the clinic. So the first concept is we assume that all CF patients have some kind of bacteria that can spread from one person to another. We treat everyone equally. We try very hard to educate our staff, our students. We have students almost every week, people with CF and their families about infection prevention and control on a regular basis. And we try to minimize the potential for people with CF to be face-to-face with each other and spread secretions, both in the hospital, and I'll show you in a minute some guidelines to prevent in non-healthcare settings. And one of those is we try to separate people with CF from others by at least 6 feet, because as I said before, you cough and you sneeze and potentially the droplets can spread for 6 feet. Hand hygiene in the hospital, well, anytime you go into the room or come out of the room. If you do PFTs and you've blown hard and you've coughed, it's a good time for hand hygiene. Even at home, after chest physiotherapy, everybody coughs during the chest physiotherapy. So after coughing or any other contamination of hands, and again, potentially after touching contaminated objects. For the kinds of bacteria we talk about, soap and water is excellent, but alcohol-based hand gels are also good. There are a few kinds of infections that they don't recommend alcohol hand gels, but the kinds we're talking about should be covered very well by those. And what we want is happy and germ-free hands. Now, as far as clinic goes, the guidelines say that people with CF are asked to wear a surgical mask of appropriate size when they enter the healthcare setting, that is, into our clinic, to reduce the spread of infected droplets and reduce acquisition of germs. The masks should be worn throughout the whole facility, anywhere you go in the hospital, except you don't wear it in the exam room when the door is closed, in the PFT room, or if you're hospitalized in your hospital room. And when you take the mask off, you take it off carefully and drop it into the trash. You don't bundle it up and put it in your pocket and then use it the next time. And of course, anytime you touch your face in the mask, you're going to clean your hands. So there's some suggestions that the guideline committee makes. One of those is staggered schedules. That is, for the younger children, especially those under 2 years of age who generally don't have a lot of infections, that perhaps may be seen earlier in the day. And maybe individuals who have CF should be seen either on a separate day, at the end of clinic, or in a separate area. The new trend is to not have people congregate in a waiting room, but place them in the exam room immediately upon their arrival. Some places do, almost like your neighborhood restaurants do. They give you a little pager and say, we'll page you when your table is ready, or in our case, when the room is ready. There are some centers that are actually doing that. We try to keep the person with CF in the exam room and rotate the staff into the room, except, of course, for going in the PFT lab. We don't have toys, computers, etc. that people can touch and share. And when you go to the public restroom, the person with CF should use the mask and perform hand hygiene afterwards. There are some suggestions from the guidelines about the PFT rooms. The term negative pressure room means a room where there's a fan blowing the air out. So air comes in the door and it goes out through a vent. That's a negative pressure room, so that in patients who have tuberculosis or measles or chickenpox in the hospital, they get put in negative pressure rooms so those germs don't have a chance to fly down the corridor. That's one potential way of keeping a PFT room clean. Another is a HEPA filter, an air purifier device, which filters out the germs and keeps the air circulating. And if there's no HEPA filter, they recommend 30 minutes between patients. You have all seen this when you come to clinic, and that is we have now closed our waiting rooms on Tuesdays because we want to put people right in rooms so that kids aren't contaminating the toys and the furniture. So Simon here is just a reminder that the waiting rooms closed on Tuesdays. So a lot of the things we've already incorporated and you've probably seen. So there's no waiting room on Tuesdays. Wearing a mask in clinic, so there's masks hanging right by the door. Room assignments, we have a meeting before everyone comes in and we see what are the patients that are coming today, have what kind of infections, and we have certain room assignments for certain types of infections. And patients who we have with CF, which is a very small minority, go across the hallway in the general clinic so that we don't have them in our side of the hall at all. And actually, there are some other types of resistant bacteria besides the patient that we might utilize across the hall as well. What you might not see is that every time someone leaves a room, our medical assistants are taking disinfectant wipes and wiping down the surfaces in the rooms. The PFT lab has a HEPA filter running all day long from the beginning of Tuesday morning to the end of Tuesday. And the spirometer, which is the device you blow in, is wiped down between patients. We're possibly getting a portable spirometer to take into the rooms as well. And Jean wears a glove and gowns during testing, as you've seen. And now we're practicing what's called contact precautions. So we all have those lovely looking yellow gowns that we wear when we come to see you, and gloves for anyone who's actually touching the patients. And of course, hand hygiene by all upon entering and leaving the rooms. We have students, I'm after them all the time to make sure that they're getting the hand gel and using it appropriately. This is what you might see in the hospital, a contact precaution sign. And this young lady is demonstrating contact precautions. She is going to touch a patient who has some sort of infection that can be spread. And so she's got the waterproof gown and the gloves on. And before leaving the room, she'll take them off, the gown off, and the gown goes in the hamper in the room, and then we clean our hands afterwards. There's even a statement in our infection control guidelines about cleaning stethoscopes between patients. Again, these are suggestions. Each center is trying to figure out how best to implement them. But what about patients in the hospital? Single rooms, contact precautions, as I said. For patients who might have flu or other airborne organisms, we might use the negative pressure room. It's pretty rare that we have to do that. If someone's going down to X-ray or someplace, we ask them to wear a mask. We try to time the timing of procedures so that 2 or 3 or 4 people with CF don't end up waiting down in the X-ray department, for example. Children don't go in the playroom, rather our child life specialists go in the room with them and provide them recreation. Treatments are all done in the hospital room, and some centers have exercise equipment, bikes and things that patients can ride have to be cleaned between use as well. Now, visitors are important because visitors can bring in germs as well. You see the signs in the wintertime about flu warnings. Anyone who has a cold or sniffles doesn't come to visit. But even at times where people aren't sick, they should be washing their hands coming in and going out. They don't need the gown and they don't need the gloves because they're not going to go see other patients, hopefully. And of course, somebody with a cold, they know they have a relative in the hospital, should just stay home and not bring their germs to the hospital. We can skip that. So we need to figure out a way, and you can help us. You see someone coming in your exam room or your hospital room and they didn't clean their hands, the bell should be going off because hand hygiene is really, really essential. Now, what about non-healthcare settings? The CF Foundation recommends that people with CF who don't live together avoid activities that could potentially spread germs. For example, social contact, going to parties, going to different recreational events, even coming to meetings like this, which is why this year we had to say only parents and family members. Handshaking and physical contact between people with CF is not recommended. Kissing or intimate contact with another person with CF. Riding the car, you wouldn't think about this, but car is a very small cubic foot area of air, and so people coughing, the germs can linger in the car, and so 2 people with CF shouldn't be sharing a car ride. Fitness classes is another place because you get going really fast and inevitably you're breathing hard and you're coughing. Hotel rooms, and sharing respiratory equipment or personal items is not recommended because all of those can spread germs. The foundation has for a long time recommended against the CF summer camps that I spoke about. And now they've actually come out with a statement that any function sponsored by the CF Foundation, only one person with CF can attend because they don't want germs to be spread. And we saw this at the national meeting last October where there are several people who are very fine researchers who do excellent cutting-edge work but who happen to have CF, and they were not allowed to come to the meeting. And they recommend, of course, for programs like this, utilizing such videos or recordings so that people can participate but not necessarily attend, which is why Dr. Comer's busy filming so that we'll have discs available for people who couldn't get here today. I spoke last week in Syracuse on this topic, and they actually had a live GoToMeeting session so that patients could sign in from home. But what about school? We get asked about school all the time. They certainly don't ban more than one person from attending the same school. That's just not practical. But they do recommend, if possible, that if there's 2 kids with CF in the same school, they shouldn't be in the same classroom. They should educate the educational personnel, the principal, the teachers, on practices of infection control. They recommend strategies to minimize contact, such as not the same gym class, maybe a separate lunch period, etc. They recommend not necessarily saying that you have to disclose what kind of bacteria your child has, although if you do so, it's certainly part of the private record. And they recommend people with methicillin-resistant staph avoid contact with anyone who has skin and soft tissue infections. The best example I remember reading about is a football team where they have the shoulder pads and all the padding that they strap on, and one person had methicillin-resistant staph, and they got on the equipment, and the equipment wasn't clean, and then the next practice or game, other people use the same equipment, and that infection can spread. So you have to be careful in settings like that. And of course, the person with CF should be educated to use their hand sanitizer appropriately. And so towels and sports equipment should not be shared, and the equipment should be cleaned between uses. Just practical, common, everyday sense things, but we know kids have to go to school. As I said before, they recommend only 1 person with CF attend CFF-sponsored indoor events, but for great strides or outdoor events, there's no limit, except they try to recommend that people with CF stay at least 6 feet apart. We want everyone to participate in great strides. Hopefully you'll all do that. In non-healthcare settings, there's certain activities where you can generate mists or aerosols from the environment that you might breathe in. For example, mowing the lawn, gardening, or touching certain organic matter. Construction and renovation can generate dust. They do say it's okay to swim in properly chlorinated swimming pools, but they do recommend avoiding hot tubs and whirlpool spas because they are very warm and they may not be well chlorinated and they can have Pseudomonas. Pets seem to be not much of a problem, but cleaning the stalls, pans, and coops, they may contain germs, especially funguses, so they recommend the person with CF not do those kinds of activities. As far as nebulizer cleaning, I'm sure you've had many of the handouts, but they recommend that the nebulizer get cleaned with dish soap and water as soon as possible, and then disinfected by hot method or cold method. The hot methods are boil for 5 minutes. Now, you have to make sure your equipment can be boiled. If you have a soft rubber mask that goes on aerosol, don't boil it because it's going to melt and it's going to stink terribly. So make sure if you're boiling that it's boilable. Or you can microwave. If you take a dish of water and submerge your parts and microwave for 5 minutes, that's good enough to sterilize. Or if your dishwasher water is set above 158 degrees, you can put it in the dishwasher. They also sell now little electric steam sterilizers like for babies' bottles. Those are also a very good way of killing germs. As far as cold sterilization, 70% isopropyl alcohol, your regular rubbing alcohol off the shelf, for 5 minutes, or 3% hydrogen peroxide for 30 minutes. And the final rinse should be done with sterile water or not tap water. Believe it or not, as much as it's safe to drink the tap water can still have germs. All parts have to be air dried before storage, and we no longer recommend use vinegar, which I remember many times we would recommend vinegar, or bleach, or a disinfectant called benzalkonium chloride. So that's what the CF Foundation recommends for cleaning nebulizers. And the other thing I put in is immunizations. Most of our patients get all the immunizations recommended. When I worked in Massachusetts and in West Virginia, there were several families that said they didn't believe in immunizations and they left their kids vulnerable to diseases like whooping cough and flu, etc. So all kids with CF get all the standard pediatric immunizations. Teenagers with CF should receive the Tdap vaccine. That's a tetanus and diphtheria booster that now contains protection against pertussis or whooping cough. And if you as adults haven't had that vaccine, if you just had the regular tetanus shots, ask your doctor about Tdap the next time you go. Flu vaccine is essential to have annually. Now, I'm sure you've seen the advertising for the nasal flu shots. Nasal flu shots are wonderful for healthy people. They're not recommended for people with lung disease because it has a live virus in it. So unfortunately, we're still stuck with the old needle in the arm. The only people that really should not get flu shots is if you have a severe anaphylactic reaction to eggs, because the flu vaccine is raised in eggs, and now they are working on egg-free flu shots as well. So infection control and prevention is the most effective way to prevent spread of infections in CF. And as I said, each center is going to have their own control policies and practices. In fact, each hospital will have their own policies. And so the last thing I'm going to show you is the third most important way of avoiding germs. And then we'll take a couple of questions.
A sad day for our troops. We flew right into the PDI trap. But world domination would yet be ours. I had one final plan, my most devious one yet. We would use their own agents against them. By spreading from person to person, we would reign supreme. Their parents, their friends, and yes, their noses would run from us. Get it? Noses.
Stick with your day job, sir.
Here we go. We'll start our attack on the school bus. I can hardly wait. So many children we can infect. Wait, what's this? Not going to school? No, no! How can we take over the universe if she stays here? She's going back to bed? Oh, her mommy's tucking her in. I miss my mommy.
You don't have a mommy, sir. You were formed by cell division.
Quiet! What? She's a PDI agent too? Ah! We were defeated by those agents, Corporal, but just wait till we bust out of here. We'll find some place with no pesky agents, and then victory will be ours!
But, sir, everyone could be PDI agents if they just follow 3 simple rules. By washing their hands, covering their cough and sneeze, and staying home when they're sick, they could easily protect themselves and others from germs like us.
Oh, why are you even with me, Corporal?
I like your enthusiasm.
Okay, so those are the 3 most important things to teach your kids. Cover their sneezes and coughs, wash their hands, and don't send them to school when they're sick. There's lots more you're going to hear about this in the next 6 months or a year, and we'll probably be putting some things in our newsletter. We have 2 minutes for some questions. Anybody have questions? Yes?
How do you deal with family members that have CF?
Oh, okay, so in families where there's more than one child with CF, they basically just don't recommend sharing nebulizer equipment and forks and spoons and cups and toothbrushes and doing their airway clearance in separate rooms. But families have to live together in the house, so we can't exactly say, well, you're going to live somewhere.
You have to stay 6 feet apart no matter what.
Right, and 6 feet apart as much as possible. And if one is sick, obviously the other one doesn't hang. It's the same common sense things you would do if your children, one of them has a cold and one of them doesn't. Mark?
I have, so the E-Flow, the Altera, the E-Rapid nebulizers that are evolving now. They say to wash with dish soap and warm water in like a container. Could you talk about at least the avoidance of antibacterial dish soaps and why they tend to do that? They say it affects the microchip. And those devices, are you aware of that?
Well, soap and water is a very good way to get rid of germs because the soap kind of traps the bacteria and then you rinse them away. But certain electronics, you have to be careful because you can't get them wet. I don't know if there's a difference between antimicrobial soaps and others, but you just have to be careful about what you get wet.
Dr. K, I think the issue with the E-Flow particularly is that it's a foil membrane with kind of almost not truly microscopic, but very tiny holes, and the antibacterial tend to leave a little foam, which is actually leave a little kind of layer, which is actually protective, from an antibacterial standpoint, but basically just mucks up those holes so the machine will stop working. That's my understanding. I don't know. We probably still don't have a
Because recommend like sunlight.
Yeah.
Dish detergents, the yellow stuff.
Each device is going to have their own, recommended do with this and don't do that.
Yeah, but that because there's tiny pores, that's how it gets the nebulization. Basically, forces the liquid through that, and it's a physical separation, into the neb, which is why it's so quiet and so quick. And those things can get very clogged up, which is why if you are using the e-flow, which is primarily with Caseton at this point, you need to follow the cleaning directions very carefully, or the thing stops working.
I'll put some of these things that I showed you in the next newsletter as well. Thanks for coming today, and again, thanks for Mark for coming all the way from Seattle.